Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. This is of a patient who attended with bilateral, really occluding and impacted earwax. That was the left ear that you just saw, and this is the patient's right ear. It was the left ear that was the worst one of the two, so I always try and start off performing the procedure in the worst of the two ears, because primarily that's the reason what brought them to the clinic. And this wax, I can only describe it as a meaty lump of wax. It was quite a haul actually in the end. And with this type of wax, it's a solid mass, and although they've been using drops, the drops didn't really do much. The core of this wax is still solid. And with this type of wax, you're just really careful that you don't inadvertently push the plug further and deeper in the ear with the suction probe. And that's because it's sometimes quite difficult to get a suction grip here. You have to hover it just over the surface. With softer wax, you can apply a bit more pressure against the wax without the risk of pushing it further in. When you've got a solid mass of wax and you don't get a suction grip because the surface is quite flat, you can actually push it further in. So in essence, what I'm actually doing with the suction probe, I'm just kissing the surface of this wax plug, almost hovering over it, and as I'm doing that, I'm making little small wriggle motions and coming away slowly back out of the ear. I can't come out too quickly, because if I do, I'll lose that suction grip, because it's the most faintest and minimal suction grip I've got there. And you can see I'm just trying to wriggle this out of the ear. And the patient had been using cotton buds. That's what really exacerbated their symptoms, because it caused them to really compact it. And you'll see once they got the wax out around the edge of the ear canal near the entrance, they've really kind of somewhat bruised their ear, but grazed the skin there. And it was a bit tender in that region. So for guys against cotton buds, you can see there was quite a meaty plug there that came out. And some of it still remaining deep in the ear, so we're just going to go back and extract that. But already their symptoms had been alleviated. Now, that wax is a bit softer, even from a distance. The sucker actually didn't have to go all the way in the ear. It was about 2 or 3 mil away from that soft plug of wax, and the suction itself brought the wax to it. And I'm just using a fine end suction probe here, just to mop up. There's a little bit just there in the inferior recess. It's not going to cause them any symptoms, but the patient still felt confident, just went there and just managed to wriggle that out. And you'll see here around the perimeter of the ear canal. So it was slightly tender, so I'm just being really gentle with the Jobson horn here, the curette, and I'm just gliding it. I'm not trying to put too much pressure on here, because I don't want to... You can see there's the bruising of the patient, and just at the base of the ear canal, you can see the colour there. It's gone a bit purpley. And just hovering over, just getting any dead skin that was loose. But the patient's eardrum was nice and healthy, no long-term damage caused. It had been causing them, actually, the main symptom with the left side, it was causing them vertigo. So when they were lying in bed and turning over to the left side, they said they couldn't lie on the left side because they were experiencing vertigo. So vertigo is a sensation of either you spinning around the room or the room spinning around you. Now, there is a condition called benign positional paroxysmal vertigo, and that can cause dizziness when people typically lay down in bed and turn over to one side. There's little crystals in the ear. They got different names, otoliths, otocania. And sometimes they get disturbed and they become loose. And when you tilt your head back and over to one side, these crystals are located within the vestibular organ. So the vestibular organ, the balance organ, consists of 3 rings. And when you tilt your head back and over to one side, these little crystals, they exit one canal, semicircular canal, one loop, and they enter another where they shouldn't be. And it sends wrong information to the brain. It tells your brain you're moving in a certain direction, you're not, and your brain gets confused because your eyes are sending it different information, and it causes severe vertigo. It's short-lasting. It's just as those crystals settle again, but you can feel quite nauseous. And I did say to the patient, well, it could be the wax, but it could also be that they've got underlying, the acronym for benign positional paroxysmal vertigo is BPPV. So they could have underlying BPPV. So we discussed there's an exercise, a manoeuvre called the Earwax manoeuvre, which can move these crystals back into the correct position. So hopefully either the removal of the wax or the exercise will sort that problem out. You can see on the right side there's a very big lump of wax there, very meaty. It's the best way I can describe it, hence the name of the title of the video. And again, the patient had been using cotton buds here. They've grazed this portion of the ear canal. They're swiveling around with it. So I'm just gently applying soft, gentle pressure against the canal wall here. Very gently though. Again, just hovering over the surface, if truth be told. And then that's the patient's eardrum. I think there's a bit of debris just there at the bottom. It's actually a bit of dead skin that they've grazed, and the skin has just become damp and it's almost wilted within the ear canal itself. So I just wanted to get rid of that. And again, they could hear significantly better from this here. And then these are the two meaty lumps of earwax. You can tell by the colour it's been there for a while. The one to the left is actually from the right, so you can see it's a bit bendy, a bit like it's got a banana arc to it. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak to you all soon. Bye.